This is the Laerdal ALS simulator, a wireless medium fidelity adult patient simulator. Certain functions on the mannequin can be controlled and operated by using a sim pad. Assessing how your patient is doing with a visual assessment can be difficult due to the fact that the mannequin does not move and does not have any facial expression. Something you can see visually on the mannequin is spontaneous breathing. If you have the question whether your patient is breathing or breathing well, the mannequin does have chest rise and fall. That also includes when applying oxygen with a bag and mask or if the patient was intubated. Respiratory rate will also be shown on the patient monitor. The patient simulator's eyes are always closed. Even if your patient is awake and alert, the eyes will still remain closed. You can, however, examine the mannequin's pupils. Pupils can be replaced and changed between sessions. To examine the pupils, peel back the eyelids on your patient. Pupils are not reactive to light, but may be different depending on the scenario that is being ran. Please interact with the mannequin as you would a normal patient. The simulation operator has a microphone and will be the voice of the mannequin. Talk to the patient as you normally would, and the simulation operator will respond appropriately through the microphone. The mannequin also has pre-recorded sounds that may be used, such as coughing, moaning, and difficulty breathing. When using a stethoscope, a mannequin is capable of producing normal and abnormal heart, lung, and bowel sounds. If IV access is available, your patient will have an IV already placed. If you need to administer a medication, do not verbalize and pretend. Please actually push the medication and use the IV access that is available. The same is true for any fluids that need to be hung. Any fluid that is pushed into the mannequin is collected in a drainage bag behind the bed. If you see this drainage bag during the simulation, please disregard it and pretend it is not there. Pulses can be felt on the mannequin, including carotid, radial, and brachial pulses. Carotid pulses can be felt bilaterally, while radial and brachial pulses will be located on the left side only. To feel a mannequin's pulses, push, include, and release. If you press too hard, you can include the pulse and you will not feel it. Defibrillators can be used on the patient simulator. ECG leads do not need stickers to attach. The mannequin has pre-placed connection studs where a 3-lead ECG can be placed. The same is also true with defibrillator pads. Pads will snap onto the mannequin. These pads can easily become disconnected, especially when performing compressions. If you notice one of the pads come off during the simulation, just snap it back on. If you are using a Zoll defibrillator, place the Zoll defibrillator pads on the front and back of the patient. Also connect the electrodes to the mannequin's connection post located on the mannequin's torso. You are now able to use the Zoll defibrillator as you normally would, including CPR feedback on rate and depth of compressions. Please be aware that you will be using an actual defibrillator. It is not a simulated piece of equipment. When you apply a shock, you will actually be shocking the simulator. Please be safe and make sure everyone is clear before you apply a shock. You may also encounter medical moulage in your simulation. Medical moulage is a way to add realism to the simulation. This can include bruises, open wounds, blood, sweat, or emesis. When your scenario is complete, we want to make sure that none of the supplies used in the simulation leave the room. Many of these supplies can be collected and reused for future simulations. We also want to ensure that no simulation supplies are ever taken to an area where they may be used on an actual patient, causing them harm. Please check your pockets to make sure you're not taking any simulation supplies with you.